Who's a good girl? Who's a good girl? Who's a good girl? Oh, hello, neurodivergent nation. Attention deficit hyperactivity disorder, ADHD, and autism spectrum disorder, ASD, they look similar in so many ways, and I often hear people mistakenly attributing ADHD symptoms to autism and vice versa. And while different, they've got a lot of similarities. So let's get to it. Are you ready? Do you want down? Okay, here you go. Both autism and ADHD may have difficulty making eye contact during communication. Autism and ADHD may both feature a communication style that includes awkwardness in conversations, not knowing when it's their turn to talk, or odd body or hand movements. Remember, like Talladega Nights? I don't know what to do with my hands. Some autistic people may talk too loudly or too much for the situation, which is also fairly common in those with ADHD. Both may struggle with academics or behavioral problems at home, and relationships can be challenging. But there are also many overlapping features of autism and ADHD that a comprehensive list would be impossibly long and full of errors. So rather than create an exhaustive list of the feature of ADHD and autism and how they might be similar and different, I'd rather go a bit deeper about why they may be similar and yet so different. As more is learned about the two, it's become increasingly difficult to separate features and characteristics of autism and ADHD from each other. While the Diagnostic and Statistical Manual of Mental Disorders, which is the DSM-5, has some clear identifying symptoms for both that provide plenty of separation, clinicians like me are finding that in many people they present more similarly than they do different. So to further complicate the matter, many autistic people also are diagnosed with ADHD, and that's called a dual diagnosis or a comorbidity. The term comorbidity means having two or more disorders at the same time, like autism and ADHD. The comorbidity rate of autism combined with ADHD is greater than 50%, and it's the most common disorder diagnosed with autism. It's also estimated that 25% of children diagnosed with ADHD also have features of autism but may not have been evaluated for autism. So it's unknown what those true statistics are. And this research I'm talking about only focuses on children. Imagine how many adults there are who have not yet been identified as autistic. Additionally, a child or adult who is diagnosed with both autism and ADHD may have the potential for complex emotions and greater variances in thinking, and that can possibly further complicate their own thoughts and behaviors. And this level of complexity can also complicate a clinician's efforts to diagnose, because self-report is a very important part of diagnosis. So, if a person struggles to understand their own emotions and their feelings and their thoughts, and if they also have difficulty articulating what they do understand, then it becomes an uphill battle for both the client and the clinician. Again, this is not all autistic people or all people with ADHD or neurotypical people even. While these two may be looking behaviorally similar on the outside, the reasons behind these behaviors may be very different. Now, an autistic individual may avoid eye contact because it causes them to feel extreme discomfort and distress, whereas a person with ADHD may not make eye contact because they're distracted, or they have their minds on something else, or they're bored with the conversation, or there's a history of being in trouble and eye contact was forced on them at some point, which may be a trauma response. Communication, that's another topic that may appear similar but have different causes. ASD and ADHD may both feature a communication style that includes awkwardness in conversations, not knowing when it's their turn to talk, odd body or hand movements, and loud, excessive talking. The ASD side may communicate like this because of a lack of interest in other topics outside of their interest. They may have a disdain for small talk and may stimulating body movements, to provide comfort, which can include talking loudly. The ADHD side may not find the conversation stimulating, and attention may wane. They may be formulating a response in their mind rather than actually carefully listening to the other person for understanding. They may find themselves speaking loudly because they're excited about what's going on, what they're talking about, and they're having difficulty regulating their body energy. One of the most challenging aspects professionals and most everyone else encounter with autism and ADHD is that features and presentation within each group vary greatly. So it's totally impossible to make general statements about either because any statement will not apply to all autistic individuals or ADHD individuals. It's unlike many of the other diagnoses or disorders that are listed in the DSM-5 that are clearly defined and criteria is well established based on many decades of research. That's not to say we won't continue to change our understanding on all disorders as we progress, but the research on ASD and ADHD is still in its infancy, and we'll likely see a great expansion of understanding going forward. Hell, in just the past few years, we've seen amazing research results that challenge the old ideas. As a clinician who works with individuals diagnosed with ASD and ADHD, I've found that I'm paying less attention to the pathological-based definition of ASD and ADHD that considers it being a set of disorders that are terrible and frightening. I don't find this to be true in my experience. I prefer to define ASD and ADHD as being a variance in neurological operations from the norm that largely involves communication, social, and behavioral differences. I don't necessarily see these two as disorders as much as I do different ways of thinking and behaving. Think Windows operating systems to Linux or Apple phones to Android. Both work, but they use totally different operating system and platforms. In a world of Apple users, given an Android to use, they might find it counterintuitive and clumsy and overcomplicated and archaic. Now, an Android user and Windows user may find the Mac and Apple phones confusing, too simplified, unable to customize in ways they want. Full disclosure, my wife and I use different phone and computer systems, and this analogy becomes more appropriate for me each time I try to use her Mac or iPhone. Furthermore, I prefer to use the words features and characteristics instead of symptoms, as symptoms are changes in someone that denotes disease, disorder, and dysfunction, whereas feature or characteristic is something that is more of an attribute or an aspect or identity, and it may be a permanent part of their lives. If you look deeper into the online world of autistic adults, you'll find that many experience autism as a part of their identity rather than a disorder. To me, autism and ADHD are not differences to be cured, but rather space needs to be made in our society. But it goes beyond the concept of just a social model of disabilities, if you've studied that. But that's a whole other video in and of itself. So with that being said, I'm cognizant of the struggles and the challenges many autistic and ADHD individuals face on a daily basis. I don't want to minimize their experiences, when comorbidity includes anxiety and depression and personality disorders and more. Having traits of autism and ADHD in a world that has not yet accommodated their needs becomes more difficult. And often masking those conditions is a common survival and a defensive skill that can have painful long-term, sometimes even permanent consequences. As mentioned, the variance within these two groups also makes it seem impossible to create a generalized list of features and presentations that represent all autistic and ADHD individuals. Some autistic individuals may avoid large groups of people, whereas others may relish an opportunity to be in a large group, possibly because they find greater opportunities to learn about others or look forward to talking about their interests to others. Some with ADHD have great difficulty planning and organizing, whereas others with ADHD do a better job with this than most other people. You see, the old criteria may represent a lot of those people who are autistic or have ADHD, but not all. And people have got to stop telling other people that they can't be autistic or they can't have ADHD because of some idea that's archaic that they have about it. For me, I'm highly empathic with regard to others in pain or feeling happiness, probably too empathic. But in other situations, I don't show a lot of empathy. So I don't really fit into the common idea about ASD. A final consideration I'd like to propose is the difference of stigma between the two. Many individuals and parents of children with ADHD are gladly willing to accept an ADHD diagnosis to help explain misbehavior or hyperactivity in their child, whereas some parents are fearful of their child receiving an autism diagnosis because they don't want their child to have a label placed on them that might inhibit them or their lives in some way. Some individuals are frightened of the mere thought of being anything like autistic characters from movies such as Raymond of Rain Man or Arnie from What's Eating Gilbert Grape, or music from Sia's movie Music, or Sheldon from The Big Bang Theory, or any number of the other media representations that have been shaping public perception of autism. Additionally, Most people know someone who has an autistic child or relative who might need a great deal of support in their lives, and some don't want to hear that they share that same diagnosis, even if their support needs are very different. So even though the stigma of ADHD and autism are very different, it is still true that the two can be more similar than many would like to admit. However, because ADHD is generally widely accepted and even used in humor, as we continue to identify the similarities between the two, maybe ADHD is going to help open the door so that autism can be more accepted and less feared in the future. As we work toward accepting both of the ADHD and ASD operating systems as neurological differences rather than something scary, we will create a world that's more inclusive, more accepting and kind, not only to these individuals, but for all individuals, as autism and ADHD have always had and will continue to have a crucial role in the forward movement of our world and society. Thank you all very much, and I hope this helps you in your neurodiverse universe. Come here. Oh, who's a good girl? You want to see Luna? Here's Luna. You want to say hi? Say hi. Look up there. Look up there. You want to say hi? You want to say hi? There's Luna. Oh, such a good girl. Oh, yes. Oh, she's a sweetie.